For the Clinical Opiate Withdrawal Scale, or COWS assessment, you're welcome to take the patient's vital signs prior to your assessment or during the assessment.
Good morning, I'm Liz.
Hi,
What name do you go by?
Brittany.
And what are your pronouns?
She, her.
She, her, okay. And what brought you in today?
Oh, my withdrawals are so bad.
So what kind of drugs are you currently using?
Oh, meth.
Meth, okay. Any opiates?
Like what?
Like any pain pills?
Sometimes.
Sometimes, okay. And when was the last time you used an opiate?
Maybe 12 hours ago.
Okay. Right now I need to take your pulse. If you'll let me touch your wrist, please. Okay. Okay, looks like your pulse is around 101.
During the assessment, Elizabeth took Brittany's pulse and noted it to be at 101 beats per minute. So for the resting pulse rate, we would rate that at a scale of 2, as pulse rate being 101 to 120.
Have you had any sweating?
No.
No sweating, okay.
In the sweating category, note that it's asking about over the past half hour, not accounted for room temperature or the patient's activity. Brittany denied any sweating, and there was no sweat visible throughout the assessment. For the sweating category, we would rate that at a 0.
What about restlessness? Are you having trouble being still?
Yes.
Okay. So have you been up pacing?
No.
No.
Brittany can be visualized being very restless throughout the assessment, frequently rocking back and forth, moving her hands, and yawning. So for the restless category, we would rate her at a scale of 5, unable to sit still for more than a few seconds. Also note that she reports restlessness, and that in the restless category, our observations are during the whole assessment.
And then I need you to look at me so I can see your pupils. Okay, they're a little dilated, but that's expected.
Elizabeth noted Brittany's pupils to be a little bit dilated during the assessment. For the pupil size category, you would need to be more specific in your rating of 0 to 5, noting the individual descriptions for each. With them being slightly dilated for this observation, we would rate it anywhere from a 1 to a 2, with pupils possibly larger than normal for light or pupils moderately dilated.
Have you had any pain in your bones or your joints?
Yes, all over. It's terrible.
It's terrible. So 0 out of 10, what would you say?
12.
12, okay.
Note that the bone and joint aches category asks if the patient was having pain previously. If they answer yes, you may need to ask more specific questions to take into account only the additional component of pain attributed to the opiate withdrawal. Brittany reports bone or joint aches as terrible in a scale of 12 out of 10. You can also note that she is constantly rubbing her joints or muscles and is unable to sit still because of the discomfort. So in the bone or joint aches category, we would rate her at a 4.
Okay, any runny nose, watery eyes?
My eyes are watering.
Your eyes are watering?
No runny nose.
No runny nose, okay.
For the runny nose or tearing category, Brittany stated that she did have watery eyes, but denied having a runny nose. Note that on the runny nose or tearing category, you will not take into account any cold symptoms or allergy symptoms that the patient has had prior to their withdrawals. This will require you to ask them a little more information of when their symptoms started and to describe it a little further. In order to accurately rate the runny nose or tearing category, you would need to ask Brittany a couple more questions. Are her eyes just moist, or are they tearing? Also note whether or not you see tears running down her cheeks. For this practice, we are going to rate the runny nose or tearing category at a 2. We're going to say that the patient was not observed with tears streaming down the cheeks and that the patient reported having more than moist eyes.
So what about your stomach? You had any stomach issues, any nausea, vomiting, diarrhea?
I have been nauseous, but none of the other.
Okay.
Take note, in the GI upset category, you're asking about the patient's symptoms within the past half an hour only. For this exercise, we're going to rate the GI upset at a 2. Brittany did report having nausea, but denied any other GI symptoms.
Hold your hands out for me straight so I can see if you have any tremors. Okay. Is that normal or is that?
No.
No. Okay. Okay.
Note that on the tremor category, you're going to specifically ask for the patient to have outstretched hands. Brittany can be observed having a slight tremor to her right hand, but not really anything noticeable to her left hand. For the tremors category, we would rate this at a 2, which is a slight tremor is being observed.
I see you've been yawning quite a bit. How long's that been going on?
I don't know, maybe a few hours.
Okay.
Brittany yawns frequently throughout the entire assessment. On rating the yawning category, this is going to be based on your observations throughout the entire assessment. The yawning category is going to be rated at a 4. The patient was yawning several times.
Now, do you feel anxious? Do you
Oh,
feel irritable?
Yes. It's so hard to sit here. Are we almost done?
We're almost done.
Brittany reports having anxiety and trouble sitting still. For the anxiety or irritability column, we are going to rate this at a 2. The patient is obviously irritable or anxious. We wouldn't rate it to a 4 because the patient is able to participate in the assessment.
I just need to see your arms one more time. I'm going to lift your sleeve. It looks like you got a few goosebumps. That's also to be expected. Okay?
During Elizabeth's assessment of Brittany's arms, she notes that she has a few goosebumps. The goose flush skin category is going to be rated at a 3. You can see the skin or feel the hair standing up on the arms. We would not rate it at a 5 because it wasn't noted to be prominent.
And I think that's all we have, and I can let you go back and get some rest.
Okay.
And I'll get with our doctor and our other nurses and see what we can do to ease some of your symptoms. Okay. All right. Thank you.
After finishing your clinical opiate withdrawal scale assessment, you will add together each category. For this exercise, your rating will be anywhere from 27 to 28 on the clinical opiate withdrawal scale. If you're unsure what number to rate a certain category, dig into that category a little more. It might require you to ask the patient a few more questions or observe them a little longer.